International Rehabilitation Forum has come to Accra, Ghana. While in Ghana for 3 weeks, we're going to take a look at the current state of rehabilitation medicine, as well as look at disability awareness in some of the most remote regions of the country. Ghana is an English-speaking country of 24 million people, 80% of whom are very religious Christians. It's located in a lush tropical zone south of the Sahara Desert with nearly 400 miles of Atlantic Ocean coastline. It is roughly the same size and shape as Arizona. In the 4 million person metropolis of Accra, only the major arteries are paved. That leaves most neighborhood streets rugged and dusty in the dry season and flooded when it rains. I'm in Adenta, one of the wealthier suburbs of Accra, and it rained last night, and as you can see, it's flooded the entire neighborhood, which means that I can't go even to the market, my internet cafe. I'm completely shut out. Public transportation is quite cheap in Adenta, with legions of minivans offering rides to the center of Accra for about $1. But even though I could get into one of these vans, the drivers refuse to stop for me. That means that the cost of getting a disabled person to work goes from $1 in the van to $25 in a taxi. But these concerns are not going unheard. In fact, just the opposite is occurring. We were invited to attend a meeting of the Accra chapter of the Ghana Society for the Physically Disabled. As difficult as the streets are, people came from all over the capital using all kinds of mobility devices to attend the monthly meeting. The disability community in Ghana is extremely well organized, and in 2007, they were able to get the Ghanaian Disability Act passed into law.
Well, I think there is a lot of improvement because the Federation has been able to work hard to get legislation that back their rights. It's the implementation we are still forcing to effect. And we also have the UN Convention of the Rights of Persons with Disability ratified. We work to get a percentage allocation of the District Assembly Common Fund for persons with disability. And we also work to get a person with disability as appointed as a substantive minister for the Ministry of Chieftaincy and Traditional Affairs.
But most of Ghana's 24 million citizens live in rural areas with limited resources. To see the condition of the disabled in one of these remote regions, I traveled to the northern town of Garu, just a few kilometers from both the Burkina Faso and Togo borders. John Allo heads up the regional community-based rehabilitation team that offers medical, financial, and social support to Garu's disabled.
The biggest challenge that I see will be how the community, including government organs, will actually receive people with disabilities to be included in whatever is going on within the context of the environment. Because the Disability Act is in place already, Ghana is fortunate to have the Disability Act, but of course it goes with challenges. Its implementation is not easy because there has to be access to buildings, access to education, access to employment, access to transport, health, and what have you.
Isaac Tuga is Garu's local CBR coordinator. He explains his organization's multidisciplinary approach.
In the team, we have a physiotherapist who is looking at physical disability. We have a mental health officer who is assessing mental health conditions. We have an eye nurse who assesses impairments as regards to eye conditions. We also have an audiologist.
The most inspirational story is that of a mother and her daughter who went from simple farmers to the most successful seamstresses in the region. My name is Tom. How are you? Fine. This is your shop, yeah? This is where you do your work.
Because of her impairment, if you come with a dress for him to show for you, he will not be able to stand up and take the measurement with a tape measure. He's not able to take the measurement. But he's able to look at you and make an educated judgment.
So in Garu, the most unlikely of places, a disability community thrives on hard work and ingenuity.